welcome to AETCM, the Emergency Medicine channel. In this video, we are going to discuss about the modified CPIS score. It stands for Clinical Pulmonary Infection Score. So this is especially applicable in patients who are in ICU setting and who are ventilated in order to support the diagnosis of ventilator-associated pneumonia. So we'll be having 5 parameters. So the first one is the temperature, and then we have the WBC count, and then we have the pulmonary secretions, and then the PaO2 by FiO2 ratio, and the last one is the chest X-ray. So based on the score that we get, we will be able to interpret whether the patient is at risk for having a ventilator associated pneumonia. Starting with the temperature. So if the patient is having a temperature between 36 to 38.4, we'll be giving a score of 0. If the patient is having a temperature between 38.5 to 39.8, we'll be giving a score of 1. And if the patient is having temperature less than 36 or more than 39, we'll be giving a score of 2. Coming to the next parameter, that is the WBC count. If the WBC count is between 4,000 to 11,000, we'll be giving a score of 0. If it is less than 4,000 or more than 11,000, we'll be giving a score of 1. And if the count is less than 4,000 and or more than 11,000 plus 50% of the band forms, we'll be giving a score of 2. Coming to the next parameter, that is the pulmonary secretions. If there is no presence of any pulmonary secretions, that goes into the score of 0. And if there is pulmonary secretions for the patient which is non-infectious, we will be giving a score of 1. And if there is pulmonary secretions for the patient which is infectious, we will be giving a score of 2. Coming to the next parameter, that is the PaO2 by FiO2 ratio. So in this, we are having a score of 0 and a score of 2. Which means if the patient is having a PaO2 by FiO2 ratio more than 240 with signs of with the signs of ARDS, if present, we will be giving a score of 0. And next, if the patient is having a PaO2 by FiO2 ratio score of less than 240 with no signs of ARDS, we will be giving a score of 2. Coming to the last one, that is the chest X-ray. So in that, the score again ranges from 0 to 2. So if the patient is having if the chest X-ray is not showing any infiltrates, then we will be giving a score of 0. If there is disseminated infiltrates, which means the infiltrates are spread, it is widespread along both the lungs, we will be giving a score of 1. And if there is local infiltrates, which means if it is confined to one space or one area of any lung, we will be giving a score of 2. So out of this, if it exceeds a maximum score of more than 6, it is likely to say that the patient is likely to develop a ventilator-associated pneumonia. Hope everyone understood. Thank you.